Hello, hello. My name is Jill Osborne. I am the president and founder of the Interstitial Cystitis Network. It is Friday, June 21st. It is time to do a drop in live support group meeting. Now, we do support group meetings twice a month scheduled. They are the first and third Sundays of the month. But I tend to do fairly frequent drop in meetings. And so just trying to capture different people, different time zones, stuff like that. Hello, Sherry. Hi, nice to meet you, hon. Hi, Lindsay. And so I have about an hour and a half right now that I can use to do a support group meeting. So I thought I would do that. Hello, YouTube. Hi, Jennifer on YouTube. It's nice to see you. I have had a morning. Let me tell you here. Hold on. I'm just trying to get my computer all set up here. If you see me all moving stuff around. Oh, all this pink stuff. I don't know about you guys, but man, the mosquitoes are biting. I woke up with this bite right there. Do you see that? I hate bites. They just hurt like a beast. Hi, Doris. It's nice to see you. Hi, Laura. Nice to see you. Hi, Lizzie. All right. So the reason why I wanted to do this today is because I did just get off the phone with Mylan Pharmaceuticals about 30 minutes ago to try to get, hi, Fawad, to get a update on Sister Project. And I have a lot of thoughts swirling my head about this phone call. What I can tell you is that at this point in time, they do not have a prepared statement. They might have one next week. We'll see. And the status of Sister Protec is kind of like in committee. Um, there were no dates, there were no details, nothing. So I am incredibly disappointed that I don't have better information to give you. Um, it is a tragic end, I think, to something that has helped a lot of people. I don't, for those of you who don't know, Sister Protect, which has been the top supplement in the IC world for a long time, was just released with a cancer warning about a month ago. And I think I have the bottle right here. Excuse me. Let's see. Yeah, here it is. So, as I continue to say, oh, Jennifer on YouTube, here, hold on. Jennifer on YouTube says, my pain is horrible today. Oh, hon, I'm so, so sorry. So, Jennifer, let's do it. Let's do a little mini triage. We'll do a little flare triage for you. When is your pain the worst? Before you pee or after you're done peeing? Let's see if we can figure out the type of flare you're having. So while you're answering that question, let me explain this with Sister Protect. So the reality here, guys, is when the only approved oral medication for interstitial cystitis, which we would now call specifically IC subtype 2 bladder wall driven, is Elmeron. It has now been associated with retinal disease and permanent retinal disease, and there are no other oral medications, quote unquote, approved. What do patients turn to? And the answer is some might use antihistamines if you've got mast cell issues, allergy issues. Some of you might use low dose antidepressants to help calm nerves down. But for the last 20 years or so, patients have also turned to some over the counter supplements. And they're very, very popular in the IC world, so much so that if you were to attend an IC class at the American Urology Association, they have been teaching these over-the-counter supplements for years to other doctors because they've been created by doctors. So the top supplement, one of the top supplements for 15 plus years has been Sister Protect, created by Dr. Theo Harides, a federally funded IC researcher at Tufts University. It has basically two mechanisms of action. It has a bladder coating effect from chondroitin and hyaluronate combined with an antihistaminic effect from quercetin. Unfortunately, the newer bottles now come with a warning: cancer and reproductive harm. And tragically, the company made the change in labeling and they did not issue a statement. Nothing. It has been 5 weeks and we have nothing from them. Nothing. And I would ask you, would you take a supplement that says warning and cancer harm orally 3 times a day? And the answer is no. 90%, 95% of our patients that I've worked with who take Sister Protect will not take the supplement, and they may never take it again. I think they feel very betrayed, appropriately so. Um, and um, it really comes down to a lack of planning and a lack of foresight on the part of Mylan. Whoever ordered the label change did not initiate the corporate communication line, and nor did they anticipate or even perhaps even think about the concept of, hey, would somebody take a supplement that says that? And the answer is no, they really probably wouldn't. So anyway, so I had a meeting with them today, big conference call, and unfortunately, there were no details. It is essentially kind of stuck in committee with attorneys thinking about what they want to say about it, yada, yada, yada. And so at this point in time, we are all still in limbo. And there you have it. There you have it. So as many of you know, we do have and as many of you have already done, is transitioning to other supplements that do not contain titanium dioxide. Specifically, oh God, my top is being all weird. Sorry about that. Stop it. My top is being all weird. Bladder rest, which is very, very similar to Sister Protect, although it's missing one ingredient, glucosamine, because that was the ingredient that really wasn't thought to be doing anything meaningful to the overall formulation. And then it has a couple of amino acids in it. The cool thing about this is does not have olive kernel oil in it, so it's much more heat stable, and will be easier to ship, and it's $10 cheaper, and or bladder builder, and or Sister Renew. So for those of you who have used Sister Protect or are uncomfortable with this new warning, just know that we've got options. Now let's go back to Jennifer here on YouTube. So Jennifer is saying that she's got terrible pain today. So I asked her the question, when is your pain the worst, before you pee or after you're done peeing? She has answered that question. She says it is after. She's currently sitting on a heating pad. So Jennifer, what that tells us then is it's really not your bladder wall that's driving this flare, because if it was your bladder wall, you would have pain as your bladder fills with urine that is relieved by urination. So if it were coming from your bladder wall, the fuller you got, the worse you felt. And as soon as you peed, you'd feel better. So your worst pain would be before you pee. In your case, your worst pain is after you're done peeing. And so what that means is that we're probably looking at a pelvic floor flare. So I see subtype 3 pelvic floor driven. So I would ask you, did you take a long car ride or have sex a couple of days ago, yesterday? What do you think triggered this flare, hon? I'd love to hear what you have to say. Hello, Julianne from Germany. Hi, Robin. Hi, Sherelle. Hi, Jody. Hi, Dawn. Look at you guys. Hi, Heath. Yeah, sometimes, everybody's very different. For some people, supplements work, and for others don't. What we do know about supplements is we IC patients are very, very sensitive. So finding the right supplement for you is definitely trial and error. Lindsay says, a warning label is a warning to us of a potential harmful ingredient that has been in it from the start, right? Yes, because titanium dioxide is approved by the FDA as a food coloring. It is banned in France. The European Union apparently is considering banning it. For a number of reasons, specifically that titanium dioxide nanoparticles, which are really, 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 really tiny, tiny pieces of tiny molecules of titanium dioxide, apparently they believe can circulate through the body and do other things, and which is why there is a growing effort to get titanium dioxide banned around the world. And it is currently banned in France, and apparently they are thinking about banning it in the European Union. There's been discussions of that in the United States. None of that has happened yet. As it stands, titanium dioxide is still a legal ingredient that can be put into food products. It is in candy, it is in toothpaste, it is in all sorts of things. But Proposition 65 requires that um, uh, any ingredient linked with cancer be properly disclosed. And then just this morning, as I was putting my makeup on, I pulled out a thing of powder and I put it on my face and I breathed it in a little tiny bit. And then I looked at the label and it was like, oh crap. And it said may contain titanium dioxide. And when you breathe titanium dioxide in, it is linked to cancer. It is linked to lung cancer. And I might have breathed some in this morning. Ugh. So, and as one other person was saying, that she found titanium dioxide into the daily fiber she was doing every day, and that in pretty much every white pill that she's taken probably has titanium dioxide in it. So it's definitely something that we all have to be sensitive to. All right. Hi, Kareen. Brenda says, how about pumpkin seed oil? Heard it helps frequency. I don't have, you know what? I got to take that back. Hold on a sec. Pumpkin seed has been discussed a couple of times in poster sessions presented at the American Urology Association. Hold on. I don't remember what that, which is why it ended up being put in some supplements about 10 years ago, 5 years ago. Um, So we've got a study in 1994, study in 2014, and a new study from this year, 2019. Effects from an oil-free hydroethanolic pumpkin seed extract on frequency and severity in men with benign prostate hyperplasia. And in that study, patients significant symptom reduction of 30% in men with chronic prostatitis, but it was an oil-free hydroethanolic pumpkin seed extract. And I'm sure that there are more studies with pumpkin seed prostate that I just did not find. All right, let's go back to Jennifer. So Jennifer says, yeah, she did a car ride yesterday. Well, that would probably explain your pelvic floor flare today, Jennifer. How long was it? Was it a long car ride? I bet it was. I bet it was. Hello, James Butler. How are you today? Jennifer says she has rheumatoid arthritis, feels like a lot of her pain started after methotrexate, which caused several other problems as my body didn't respond well. You know, Jennifer, you wouldn't be the first person. I've heard people talking about methotrexate before. It's kind of a little. I don't think that we can say for sure that it's a. Let me look at. Hold on. Hold on. This is when I really wish I could share my screen, but because I simulcast on YouTube and Facebook, it's hard. Hmm. I'm sure that we could do a lot more research on methotrexate. That's for sure. All right. So Jennifer had a 2-hour car ride. And yes, my dear, I think it was the 2-hour car ride that got you. Lindsay said, yeah, they should definitely get rid of the titanium dioxide. We would rather it be safe. Who cares what color the pill is? Absolutely. Absolutely. I don't know how I mean, I don't know how to fix this. I mean, with the patients that I've talked with, it's a bit of a betrayal of trust. Here you have a very trusted brand and to kind of offer no context and foundational information to the patient community who are taking it is it really kind of dereliction of duty? I mean, normally a company would do that, and I don't know why that didn't happen in this case. Debbie says, just started Bladder Builder 3 days ago. She's had no adverse reactions, so that's promising. I wonder how long it would take to kick in. I'd give it 2 weeks, hon, especially if you're starting slow. Give it some time. Guys, when you take Bladder Builder, you always want to take it with a little bit of a fat, like a couple of almonds, a little bit of avocado to help it absorb. Maybe, Sherry, maybe I can do searches on tablets. Yeah, I've got my tablet right here. Betty, having surgery in 3 weeks, have to stop the Elmeron 2 weeks before and 2 weeks after due to blood thinning. Do bladder rest and bladder builder have blood thinning properties? Not like Elmeron, hun. Elmeron is really well known as a blood thinner, and so it's very common for patients to be told to get off of the Elmeron. Usually, it's 6 weeks before surgery, and so I'm not aware. I mean, we could. Oh man, I'm sorry. I'm just all. See, this is what mosquito bites do to me. You give me a mosquito bite and my skin crawls. My skin is crawling today. I've got 3 mosquito bites right now. It's driving me crazy. Do bladder rest and bladder builder have blood thinning properties? Not that I'm aware of. Not that I'm aware of. Dawn says, any car ride over an hour aggravates her badly. Yeah, it can. Boy, for me, when my IC was really bad, driving 15 minutes was rough. Brenda says, um, she wants to know about coaching. So, you guys, we do the IC Network and I do coaching. We have 3 coaches on staff who help patients. I do the vast majority of the coaching, but we have Julie Beyer who does dietary coaching. She's a registered dietitian. And then we have Heather Howard who does coaching with couples who are struggling with intimacy. Everybody, you can, the IC Network is the only patient group that has a phone line. You're welcome to call the phone line. It's free. It's an 800 number. And if we can answer your question in 5 or 10, 15 minutes, happy to do it. Absolutely no charge at all. So we do all day. However, if you want to spend more time, like an hour, hour and a half, really getting into your case, something like that, then you can sign up for wellness coaching, which we do on our in our shop. And wellness coaching is $50 for 30 minutes. So, but 9 times out of 10, guys, we can answer it very, very quickly, and it's free. Leanne said, "Hi, I wanted to say thank you. You've helped me so much. Found out on the 7th of this month with this since I was 13 after menstrual cycle, 47 now." Awesome, Leanne. Happy to help. Just know, guys, Facebook feeds through very quickly. I only have about another 50 minutes, and then I'm gonna have to get off because I gotta drive my 90-year-old mom somewhere. So I just thought we'd come in and answer any questions that might be going on. Jennifer wants to know, where can you get Bladder Builder? You can get it right from our website, IC Network. Just go to icnetwork.org, click on shop, and it'll take you over to our store, and you can buy it there if you want. And I just want to say, guys, the IC Network started out as a support group. I mean, it was my doctoral dissertation proposal to bring support to patients who were homebound. And so for the first 5 years, it was entirely free, and our website is still entirely free. The support group meeting is entirely free, yada, yada, yada. But it got really big, really quick. And eventually we were working with 200,000 plus patients a month. And so we got to the point where financially I couldn't pay for it. And so all on my own anymore. And so we started selling stuff and books, chair cushions, heating pads, and then eventually supplements. And there was a very specific moment that led to me selling supplements. And that was over InterStem. We had a doctor in Colorado who was telling patients the only treatment for IC was surgery. And he was making a ton of money doing InterStem. And a couple of his patients over a couple of months called, and only to discover after the fact that he didn't tell them about diet. He didn't tell them about Elmeron. He didn't tell them about anything. He just said, you have IC, you have to have the surgery. And it just kind of dawned on me that patients needed a place where they could see what their options were. And so that's when we started doing pre-leaf, and then Sister Protect came out, Sister Q came out, and I decided that the IC network would do that. In the end, though, we are a support group, and I always try to act and conduct myself with respect to being a support group leader, which is why I'm usually the first in the IC world to talk about problems like the cancer warning and like the Elmeron eye problem. Alrighty then. Well, I tell you what, let's do this. Let me give me a moment here. Let us see what's happening in the IC world from a research standpoint. I always say, man, information is power, my friends. Information is power. Nobody can tell you if IC is all in your head if you actually know what the research is. So let's take a look at the research for a moment. Let's see what's happening. First article, transurethral resection of bladder endometriosis. So here's a case report of somebody who had endometriosis. So here's a patient. Oh, this is fascinating. And where was this? Let me see where this was. Even more interesting, comes from the Middle East. Urinary endometriosis is a rare condition, accounting for 1 to 5.5% of extragenital endometriosis locations. The diagnosis takes a long time, in which patients are diagnosed with UTI or interstitial cystitis. In this case, 25-year-old woman presented with cyclical pain that lasted for 10 days every month for 6 months prior to diagnosis. She had had 3 times a C-section. And it turned out that when they looked in her bladder, she had a endometrial mass on her bladder that was 3 centimeters by 2 centimeters that they cut out. Chocolate. Wow, fascinating. Turns out it was a brown appearance. That's how they diagnosed it on the bladder wall, is it was a brown in color. Remember that the endometriosis can attach anywhere in your pelvis. It can attach and wrap around your bladder. It can attach to bowel. I can actually migrate up towards other issues. I think that they've even found endometrial tissue up around the heart sometimes for some patients. I think that's rare, but that's happened. There are moments when endometriosis can attach to the bladder wall and or work right through the bladder wall and trigger some of these symptoms. Let's see what else we got. Here's a study on curcumol, a variant of curcumin that's from China. Curcumin always kind of scares me a little bit. This is really, yeah, intracellular expressions of PTK2 and PTK2 TYR397. Yeah, we don't need to talk about that. Okay, we'll move on. Extreme scientific, extremely scientific. Oh, here's an interesting study, a comparison of somebody doing sodium hyaluronate in their bladder combined with oral chondroitin. Now, where'd this study come from? This looks like it's Russia. Huh. 59 patients were randomized into 2 groups. Group 1 received sodium hyaluronate into their bladder for 12 weeks. Group 2 received the same intravesical therapy with chondroitin sulfate. Conclusion, the combined therapy of both provided significantly better results than using sodium hyaluronate by itself. And you notice they didn't say glucosamine, they just said chondroitin. That's fascinating. Let me check here for questions. Hey, Jennifer, getting back to you on YouTube. I'm sorry. You are in a pelvic floor flare, so you need to use heat. We got to get those muscles to relax. I would get in a hot shower. If you've got to anything that you can do to try to relax those muscles. If your pelvic floor physical therapist gave you some exercises and stretches, this would be a really good time to do that. If you have a muscle relaxant, if they gave you something like vaginal Valium suppositories, this would be the right time to do something like that. But just know muscle flares go away. You're going to get better, hon. You're just in a wicked flare right now. Deep breathing. Guys, if you sign up for our newsletter, you'll get our free 40-page flare management guide that will give you hour by hour rescue plans. You might want to think about doing that. That might be helpful if you're over on the IC Network page. It's an article from China on sexual pain in IC, and that's one of those studies is like, yeah, duh. And it's not just for women, it's for men too. If you've got tight pelvic floor muscles or vulvodynia, there's a chance that sex is going to hurt, right? So in particular, women with IC show vulvodynia. Yeah. Okay, we got all that. We got that. What? They suggest that we need to explore the connection between IC and vulvodynia. Proposed theories include hypersensitivity of the peripheral and central nervous systems. Well, duh. Okay, sorry. I'm a little fighty today. That's one of the things that was very frustrating about the federally funded IC research program, especially 10, 15 years ago. We've had a couple of IC groups. We had the IC Clinical Trials Network or Clinical Trials Group. We had the IC Clinical Research Network. And they had this central committee that decided what they were going to do. And it was extremely conservative committee. And so all of us here on the outside, we're kind of like way past Elmeron. Let's look at other stuff. And yet they kept going back to Elmeron and Ellaville for their studies, and it was so frustrating. And you're kind of like, guys, we already know that. Don't waste any more money on that. Let's look for something else. Let's move in a different direction. Suplaplasticity is a therapy that's been discussed. It's a cytokine inhibitor. 4 studies in Japan. That's just a weird study. I got to read more about that. I can't really talk about that. Hunter lesion versus non-Hunter lesion. Oh, here we go. Here we go. This is interesting. Okay, so this is a good study. This is a good study. So remember in our subtypes of IC, right? We know that a one treatment fits all doesn't work. Why? Because there are different variations of IC. Some of you have Hunter's lesions, others of you have pelvic floor, some of you might have central sensitization, some of you might have chemo-induced itis, et cetera, et cetera, et cetera. And so, what researchers have been debating for the last decade now is what are the variants or what are the subtypes. And here is another international study featuring Christine Whitmore, a pretty famous doctor here in the United States, Magnus Fall, very, very famous doctor in Europe, as well as a couple of other international doctors who were reviewing the literature regarding Hunter's lesions versus non-lesions. And the prevalence of lesions is reported to be 5 to 57%. No. That's just in multiple studies. It's just, okay. Hunter's lesions visually is a quite typical inflammatory reaction, a reddened mucosal area with small blood vessels radiating towards a central scar. Yeah. We know this. Biopsies show inflammatory infiltrates, granulation. Yeah. Okay, we got that. Oh, God, that reminds me. I got an interesting story to tell you. Nitric oxide, yeah. Anyway, they concluded that Hunter's lesion patients are clinically and pathologically distinct from non-Hunter's lesions bladder pain syndrome. So remember, we've got this really strong movement to split Hunter's lesions off as its own disease, and I agree with that completely. Okay, so you know that I have absolutely no shame. I'm willing to talk about anything, right? Okay, so like, I am willing to talk about freaking anything. And I'm in a mood. So, I think I shared a couple months ago that I thought I had a yeast infection. And it was started during the winter time, and I used a heating pad in bed, and I thought I'd just cook myself up a nice warm inviting environment for a yeast down there. Um, but my gynecologist was really puzzled because the very first thing she said when she looked at it was, "Do you wear mini pads?" I was like, "Yeah." He goes, "This is exactly the shape of a mini pad." Like, okay, that's weird. And she goes, "Stop the mini pad. Just don't wear the mini pads." And then they scraped me for yeast, and they thought they had yeast. And this began a 3-month odyssey of trying to fight this quote unquote yeast infection. And nothing was really working. And so she finally, 3 weeks ago, and it was just still redness in the shape of a mini pad, right? She goes, "Jill, we need to do a biopsy. We have to do a biopsy. This is so weird." So I got my biopsy results yesterday, and it is chemical dermatitis. Atopic. It's a I forget the exact word. Anyway, obviously it's not cancer or anything like that. It's just a chemical reaction on my skin. So we're like going over. She's like, "Okay, let's roll everything out. What soap are you using? Okay, Dove Unscented, perfect. What laundry detergent are you using? Okay, all, yes, perfect. Are you using anything else down there? No. Um, and we're like going through the list. Is there anything that is irritating me down there? It's like, is it a cream? Is it whatever? And everything is ruled out, right? And she's like, "Jill, come on now. We already know you're doing everything." And she goes, "Clearly it was the mini pad. There was something in the mini pad which triggered with the equivalent of eczema on your vulva." How weird is that? That reminds me, I've got to call always and file a complaint because that's what they think. That's exactly what the biopsy showed. It was a chemical reaction to something. And I don't know if you've ever opened a new box of mini pads or menstrual pads. Um, every now and then you get a lot that has a really strong chemical smell. And I know that because it like smells like glue. And so I several times I would take them back down to my grocery store and say there's something wrong with this, and I'd get a new one, open it up, and it didn't have the chemical smell. So I was really rushing that day. I had a new box, ripped it open, threw it on, rack away, and then by the end of the day I was a little irritated down there, and I went, and I went and smelled the box, and it smelled terrible. It smelled really, really strongly like glue. So, like one mini pad, 4 months later, I still have skin irritation from it. It's like, what the hell was in that mini pad? So now we're doing steroids, and I feel better already. But it's the whole chemical issue. Your body being exposed to chemicals is really rough, and you think you're doing the right thing, and there you go. You might not be doing the right thing. Hi, Cindy. Hi, Gigi. Hi, Morika. Hi, Beth. Leanne says, "What do you think about doing baking soda and water going 27 times a night? Did Botox every year, didn't help. Went to a wonderful urologist, found you have IC." Okay, so Leanne, number one, we got to figure out why you have frequency. Is it because you have untreated Hunner's lesions, which would certainly explain the frequency? Or is it because your bladder wall is irritated? And if it is your bladder wall, we need to figure out why. So the first thing we're going to look at is diet. Are you drinking 1 cup of coffee a day, soda a day, whatever? That would absolutely trigger this. Or do you have genitourinary syndrome of menopause? Is your skin so thin, your mucosal layer so thin that your bladder cannot defend itself from your urine? Or it could be something as simple as taking a multivitamin every day, right? I mean, if you're taking a multivitamin every day, that's actually really irritating to those of us who are older who don't have a nice, thick, robust bladder coating because we don't have as much estrogen. Remember, the mucosal layer in your bladder relies on estrogen to produce mucus. So when you're young and you have lots of estrogen, you've got a nice, thick bladder coating. When you're older and you have much less estrogen, you have much less, a much smaller, thinner bladder coating, which means that your bladder in your 50s and 60s is going to react to foods that it didn't react to in your 30s and 40s. And that is not a disease. That is not a disease process. That is aging. That is estrogen atrophy. Frequency comes from the alpha afferent nerve in the bladder wall. Urinary urgency frequency comes from that specific nerve. And generally, that means that nerve is being tweaked in some way. Amanda says, thank you so much for helping. My doctor told me diet and Elmeron were my only choices. My insurance doesn't cover Elmeron. You are the reason I know I deserve another doctor's opinion. Oh, I'm so glad, Amanda. You deserve the best. Anna says, hi, Jill. Great to have your supporting meetings. Truly appreciate pain plus frequency quite heavy. You're on pain meds every day for the past 2.5 years. I'm so sorry, hon. We got to figure out why you're in pain. Veronica, can laser treatments help IC? Are you talking about the vaginal laser treatments? The answer would be no. If you're talking about laser therapy of a Hunner's lesion, the answer is yes. When you laser a Hunner's lesion or you fulgurate it, you can effectively cauterize that lesion. But if you're talking about that vaginal rejuvenation laser therapy, that's not going to help. That's not going to help your bladder at all. And it's pretty controversial now. I think the FDA sent out a warning about it like a month ago that it was being there were way too many promises being made about that. Wendy says she did urgent PC, that it really helped you with the urgency. Good to hear it. You guys, I was one of the very, very first urgent PC patients back when it wasn't called urgent PC. And I think I can show you. Oh, you can see that little tiny black spot there. That was my tattoo. So back in the old days, when it was invented by Dr. Stoller, what they did is they did weekly treatments for 10 to 11 weeks, but then they gave us the needles and the unit and they taught us how to do it at home. And I did it at home for about a year. And that urgent PC helped me tremendously. It broke me out of a year-long flare. I had my first 2 hours without pain at week 4, and I had my first day without pain at week 7 after this ankle post-tibial nerve stimulation therapy, which is a step 4 treatment option in the AUA treatment guidelines. Laura, Laura. Okay, now this is interesting. Laura, you found out you have 2 cysts on your bladder nerves? Girl, tell me about it. That's very interesting. What kind of cysts and where on your bladder? Well, Leanne says going through menopause. That's what happens with menopause. Ravonda. So Ravonda says, could you fill me in on the Sister Protect update? So I had my first meeting today with Mylan executives about 90 minutes ago, and they have no public statements ready. It is still apparently in committee, for lack of a better term. They're waiting for their attorneys to decide what they can and cannot say about Sister Project. They asked me what I thought they should do, and I said, you need to get a statement out immediately and an apology to your customers, to leave them in this limbo, and to have issued this cancer warning with no explanation. You know, it's just nothing short of astonishing. It's a cataclysmic marketing mistake, in my opinion. I was pretty blunt with them, and because patients are being really, really blunt with me, I had a lady yelling at me last weekend, saying that I had to have known about the cancer warning, and I said no, I didn't know. And as soon as we found out, within an hour, we suspended all sales of Sister Protect until we got more information, which of course the company still hasn't officially publicly announced, although privately they have admitted that it is due to the titanium dioxide. Um, Believe me, listen, guys, And I was trying to explain it to them. It's like I have this double role. I'm a support group leader. I have a triple role. I'm a support group leader, and I love being your support group leader. I am a patient, and I have used Sister Protect myself. And I also have the IC network, and I have to represent that too. And Sister Protect has been an important source of income for all of our IC activities, like IC Awareness Month. But I always put my role as a consumer advocate first. Okay, this shirt is driving me freaking crazy. Ugh. Okay, next time, remind me to wear a pink bra. Oh my God. Okay. So anyway, as I was reading through all this stuff about titanium dioxide, it just like came to me. It's like I would, I personally would never take it again with titanium dioxide in it. I think the risks are substantial, even though it's FDA approved. When you look at the new studies, that's pretty scary stuff. And I knew that I had to say that to you guys, and which I hope tells you that we're not in this to make a buck. We're in this to help. And we immediately stopped everything when this came out. I hope that makes sense, kind of, sort of, in a weird way. Same thing with the Elmeron thing. Cindy says you're not sure if you need to go back to the emergency room. You have a UTI with fever, but no other symptoms. You're on an antibiotic. Girl, if your fever is getting worse, you got to go back to the emergency room. Monitor that fever. If it's worsening, you have to go back to the emergency room. We do not want that fever to become systemic. If you have, guys, my policy in the emergency room and calling the doctor is anytime you even have to ask that question, I'm not sure if you need to go. That's when you really need to think you might need to go. Anytime you're scared, anytime the pain is so intense that you can't move, um, come on. That means that you're in crisis and you need to go to the emergency room. And if you've got a fever that's out of control, you need to go to the emergency room. No hesitation. Call your doctor and go. Wendy says, is that why your symptoms are worse because of menopause? Probably, hun. Probably. Now, of course, you might have untreated Hunner's lesions. You might have worsening pelvic floor. That's why the subtyping is so important. We need to know your variant, right? So if you got Hunner's lesions, we got to work on that. If you got bladder wall driven pain as your bladder fills with urine that is relieved by urination, then we're absolutely going to be looking at uh, uh, whatever is impacting the health of your bladder wall, including menopause. Laura says you have 2 cysts on your sacral nerves that go to the bladder. Holy hell, girl. What are they going to do about that? Cindy, that's not true. Cindy, what you just said, that's not true. There's no evidence that Cystoprotect causes cancer. There is one ingredient in Cystoprotect, titanium dioxide, that if you powderize it, cut it, and breathe it in, it can cause lung cancer. But the FDA says titanium dioxide is approved as a white coloring. It is in all your toothpaste and stuff like that. But it does have a cancer warning on it because of the titanium dioxide. And that is deeply, deeply concerning and unfortunate. If they had a direct connection like that, there would be a product recall. There is no product recall right now. We're operating on an abundance of caution here. That's my perspective here, is that it's very, very important, I think, that you guys know any issues that are coming up. And the fact that Sister Protect came with a cancer warning cancer and reproductive harm with no supplementary information with it from the company is nothing short of disgraceful. On your spine, are they going to operate, Laura, take those cysts off? Kathy, Jill, I'm going on a cruise that includes an excursion on a bike for 9 miles in Amsterdam. You've been symptom free for a while, but the bicycle If you got pelvic floor dysfunction, you sitting on a bicycle for 9 miles could really exacerbate that pelvic floor. I don't know, hun. I don't know. You're just gonna have to see how you feel. I mean, the things about tours is normally they have some sort of accommodation. Maybe you could just go for half of that, and then they can pick you up. They can have a car ride for you. If you've got pelvic floor dysfunction, especially if you've got pudendal neuralgia, I would not be doing a long bike ride. I think that's a mistake. Susan says she's had a lot of issues with pads, but being on compounding creams, you need them. The pad I've found it the pad I have found so far with less irritation but not perfect are the chlorine-free ultra thin pads with no synthetic pesticides, dyes, or fragrances from Amazon. Sue, my pain is always just in my urethra and right above. What type of IC would that be? That would be probably be estrogen atrophy of the urethra more than anything else. Anytime you've got urethral pain, we're going to look at this in a very, very different way. The urethra is kind of the canary in the coal mine when it comes to the urinary tract and how it responds to aging. And so if you feel like if you are perimenopausal or menopausal, so that means you're age 40 over, for some women, sometimes earlier, the urethra is often the first part of the urinary tract to react to the loss of estrogen. And for me, it felt like there was a drop of urine stuck in my urethra that would not come out. And so, and it was very, very irritated. I threw everything I knew at it for uh 3 months. Finally ended up at my urologist saying, please tell me my urethra is screaming. And he took one look at me. I mean, imagine I'm laying on my back with my knees in the air, he's down looking at me through my knees, and he goes, Jill. I'm like, what I do? He goes, didn't you use the estrogen cream I prescribed for you a year ago? I went, no, I didn't think I needed it yet. And he goes, oh, you needed it. He said, I wouldn't have prescribed it for you if I didn't think you needed it. And he re-prescribed it. I put a pea-sized drop on my finger, rubbed it into the entrance of my urethra, and within a week to 10 days, it was gone. And if I forget to do that now, it comes right back. So, but we have another article on our website called The 7 Causes of Urethral Burning or Urethral Pain. So it can be pelvic floor, it can be an infection of the periurethral gland, it can be a reaction to chemicals. I would encourage you to go on over to the IC Network website and search for The 7 Causes of Urethral Pain. Look for that blog, and that'll give you more insight into that. It's not the pedaling on the bicycle that's the problem, it's the sitting on the bike seat that's a problem. Like, if you could stand and the whole trip, you'd be fine. Or if you can just get a modified seat, they have a seat it's like 2 round circles that your butt cheek is on, but there's nothing pushing up against your urethra. That would be good. Carol says, starting pelvic floor physical therapy. Are there any books and videos to share? Oh, girl, yeah, absolutely. Let me get them. Hold on, my friends. Hold on. You want to see them? I will show them to you. All right. All right, so these are the resources that we recommend for people with pelvic floor dysfunction that are trying to learn about it. If you're a gentleman, Ending Male Pelvic Pain by Isa Herrera. And the cool thing about this is it's pictures of guys in almost all the pictures. So for men, it's very unique to you. See? For women, it would be Ending Female Pelvic Pain by Isa Herrera. You see all the post-its I have on it. I mean, I'm telling you, I learned more about the pelvic floor in 5 minutes just reading the introduction of this book than in everything else. Or for men or women, you can do Heal Pelvic Pain by Amy Stein. And in terms of videos, there are lots and lots of really good videos on YouTube. Lots and lots of really good videos on YouTube by various physical therapists. So go on over there, search for pelvic floor dysfunction. But remember what I say, and that is when you have your pelvic floor assessment, you should walk out of that physical therapist's office knowing the name of the muscle that's the issue. Is it the levator? Is it the piriformis? Is it the glute? Is it the psoas? And then when you go over to YouTube, I don't want you to just search for pelvic floor. I want you to search for rehabilitating that muscle. Give them the muscle name, and you will see a lot of physical therapists who have done some really really good videos, like Nicole Kosian of Pelvic Sanity, physical therapist who wrote the book, The Interstitial Cystitis Survival Guide. I mean, Interstitial Cystitis Solution, Pelvic Pain Rehab. Stephanie Pendergrass, Elizabeth Rummer have done some really, really good videos and blogs from their website. And for those of you who don't know, there is a Your Pace Yoga, a yoga program for men and women with pelvic pain. If you would like to do fitness in that way, try some yoga. This is available on the IC Network website. Also, New Dawn Pilates for pelvic pain is another option that you could potentially try. I know in my case, my latest physical therapist said is I had done way, way, way too much stretching and I had overstretched some muscles, and he wanted me to do Pilates instead. And healing the pain down there might provide, there's a physical therapy component to this. This might provide a little bit more information to you also. So these are all available over on the IC Network website, icnetwork.org or ic-network.com. Hello, Faith. Thank you for joining us. Leanne says, my doctor wants me to start physical therapy soon. So glad to get help. Having this has been so hard. You've been depressed for a long time, have this problem, always have to go to the bathroom. Yeah, I know, Leanne. Remember, girl, you got a lot of reading to do. I see, we have this kind of old perception that IC is quote unquote incurable bladder disease. We don't think that anymore. We think IC more as a pelvic pain syndrome. Why? Because we know other structures in the pelvis are involved besides the bladder. Besides the bladder. So it can be muscles, it can be nerves, it can be other pain related conditions, right? And that's what we're trying to do now with that diagnostic process is we're trying to understand your unique variant of IC so that you can find the treatments that will be the most effective for you. Mary Jo says she had a blood clot and your doctor doesn't want you to use estrogen. So if you can't use estrogen, then you'll need to find something else that will at least give you some comfort with that dry skin down there. And that's where again something with a bladder coating effect might be beneficial to you, like bladder rest or a bladder builder or Sister Renew or Desert Harvest Aloe. And guys, I have to take a moment. We always have to acknowledge a sponsor for these meetings. Our sponsor is Preleaf. I swear this summer, I mean, it's almost summertime now. Is today summer? Today's the summer solstice, right? Longest day of the year. Nice. Would you, if you would like to see support group meetings 3 days a week for 2 hours, I'm really going to start doing that. We just have to find the right times. That's a problem. All right, Preleaf. Preleaf is the most popular supplement used by IC patients for well over 30 years. It is an acid reducer. If you find that you've got to go somewhere and you're going to be exposed to something that you know would be acidic and irritating to your bladder, using some Preleaf Before that would be a good way of kind of modulating and reducing the effect of that acid on your bladder. This has helped tens of thousands of patients over the years. It is calcium glycerophosphate. There is no titanium dioxide in it at all. There never has been. You don't need to worry about that. In fact, I was exchanging emails with the company about Pre-Leaf today. We were supposed to have a meeting today, but we got our time zones all mixed up. There's nothing worse than getting a phone call early or getting a text early in the morning saying, "Aren't we meeting?" And I'm like, "Yeah, aren't we meeting Pacific time?" And they're like, "Oh, we thought that was Eastern Standard Time." It happens. As always, with any supplement, you don't treat it like candy. You shouldn't be taking this all day, every day. You take it when you're going to eat something at risk because it is made of calcium and it can contribute to calcium-based kidney stones in people prone to calcium-based kidney stones. Other than that, it is one of the most trusted, reliable supplements out there. Alrighty. All right, I'm just not going to sit on that cushion. Oh my God, driving me crazy. All right. So Tarlov cysts, that's what you've got. You've got Tarlov cysts. So they can have they talking about surgically removing those? Because they can potentially surgically remove them. Tarlov, Tarlov cysts are again one of those kind of lesser known conditions that can cause all the symptoms that we associate with IC. Although in this case, is coming from a little cyst of spinal fluid collecting at the base of the spine. It's very interesting. Diane says, "Thank you for all you do, Jill. I've been following you for many years. My pain is the worst in my urethra. I would check out the site." Yeah, girl, come on over to IC Network. Oh, wait, that way, icnetwork.org, and just search for 7 causes of urethral pain. You'll find that. Brenda, yes, you can call and leave a message with your number, and we'll take care of it. You guys, you have to remember that if you've got a bladder injury, nothing happens overnight. It is physically impossible for the bladder to repair itself in 24 hours. Because the bladder has the largest single cells in the human body, it takes 2 weeks for one surface cell, one urothelial cell to be replaced. So it's not quick. And unfortunately, when, where's my picture? So look, again, the 3-dimensional picture of the bladder wall. So we got the top layer mucus, right? And then we've got 4 to 5 layers of urothelial cells, and you got blood vessels, nerves, and stuff like that. These urothelial cells are the largest single cells in the human body. When one is damaged, like this one, there is a little tiny stem cell underneath it that will replace it. But it takes 2 weeks for that stem cell to grow, to become this big giant cell, and to change shape and fit into this spot. And it was a lecture that I attended at an IC conference by Anthony Schaefer, a pretty famous urologist, who explained that when these cells are damaged and you've got these little tiny cells that are trying to repair it, they are exquisitely vulnerable to acid. And this, I think, really helps us understand why people who drink 1 cup of coffee a day usually don't get better. Because if you're pouring acid on these cells that are trying to repair your bladder, you're going to kill it. So what I say to patients is every time you drink a cup of coffee or you have a soda and you've got a wound, you've killed all the new cells that are trying to repair it. And then by killing those cells, you've set yourself back 2 weeks worth of healing again. And that's why it's so important when you sustain a bladder injury to protect those tissues and follow the diet for a good 3 to 6 months minimum to give them all an opportunity to try to heal, and then slowly introduce them one at a time and see how you do, right? I am fascinated by the biology of the bladder. I think it's very interesting. Kay says, does the titanium dioxide cause any problems when it's on our sunscreen? I think they're talking about it. I don't know that much about the sunscreen side to it. Karina says, I'm going to give everybody advice to go on a low oxalate diet. Problem solved. Do your research, look up oxalates. Doctors don't even acknowledge them. They're little crystals and very painful, and that's why the bladder hurts and a lot of other things in the body. So that's actually true. Oxalates are a very irritating chemical that is a byproduct of some of the foods that we eat. Some foods that are high oxalate, like berries or chocolate or spinach, are high oxalate foods. And some of us are much more sensitive to foods that are high in oxalates. If, for example, you drink a lot of almond milk, almonds are high in oxalates. And, oh, I was talking with somebody, gosh, a couple years ago who went through a really bad bout of kidney stones, and they were calcium oxalate kidney stones. And he didn't understand that he had been living on almond milk. And then when he did more research, he said, there's a massive rise in oxalate stones because of the massive rise in almond milk. And so, whether it's oxalates contributing to kidney stones or the actual crystals of oxalates irritating the vulva, the urethra, that's very, very real. Karina is right, except for her last statement. Darn it, Karina, you were doing so well. um, uh, Karina, the last thing you say is IC is not a disease; it's a symptom. Yes and no. IC is a syndrome of urinary symptoms and pelvic pain for which there can be many, many potential causes, from Hunner's lesions to fibroid tumors to endometriosis to pelvic floor injury to central sensitization to pudendal neuralgia. It is absolutely a syndrome. At one point in time, a doctor called it a grab bag diagnosis, and we were all offended by that. But in hindsight, he was right. It's kind of what the name that they label anybody with frequency urgency pain with. What we do know, though, is that in those subtypes, there are some subtypes that there are two variants that could be a disease process rather than an injury process. And number one is Hunner's lesions, because Hunner's lesions have now been connected to two viral infections, polyoma BK and Epstein-Barr. They have found those viruses in the urine of patients with Hunner's lesions. That would make that a disease process. And the second is a subtype of bladder wall driven, which would be either chronic and fungal infection or chronic bacterial infection. That is a small subtype. We're long past the day of thinking that everybody with IC has infection. We certainly know that's not true, but there are some of you who might actually really have a little chronic infection or a fungal infection going on. And it was our own MAP research network, federally funded National Institutes of Health IC research team, that found that some patients having flares actually had fungal infection. So that is in essence a disease. All right. So you almost had it. And your point about oxalates, 100% right. 100% right. And I'm going to say the same thing about gluten-free. Listen, gluten-free, some people think gluten-free is a fad. The reality is that gluten-free can be irritating to some patients. I'm one of them. I definitely feel better when I go gluten-free. If I start doing a lot of gluten, I struggle. Hello, Marie Jordan on YouTube. Nice to see you, hun. You guys, I'm going to have to leave in 9 minutes, 9 to 10 minutes, just so you know. I love all your feedback on Preleaf. It's great. Awesome. Hi, Brittany. Hi, David. Janice says, "Uh-oh, I drink almond milk because of lactose intolerance. Can't use soy." You know what, Janice? Try coconut milk. Try some coconut milk. See how you do with that. I did. That's what I turn to. I don't do soy milk or almond milk, but I do coconut milk, including coconut milk in a little bit of the rare times that I do coffee, decaf coffee, or with frozen stuff. I do coconut milk ice cream. Actually, little bars. Tanya says, my doctor gave me a steroid cream Similar for vulvodynia. Do you feel that this can help or hinder? Honey, if you've got estrogen atrophy, normally we would be doing a little bit of estrogen cream. I was just explaining earlier that I'm currently using steroids for a chemical irritation on my vulva. Um, uh, would if you're asking if it would hinder your IC, I don't think so. I think it's about calming and soothing your skin. Um, but you ask your doctor. Share with your doctor what your concerns are. Okay, seriously, if you're calling me, I'm not going to answer the phone. Leave a message. Thank you. I will get back to you. I promise. Whoever you are, I will. Linda, I have 6 weeks of chemo radiation, which will obviously cause more pain to my already Hunter's lesions, UC bladder. Any ideas how to protect it? We've asked all the doctors many, many times about how to get through chemo or chemo when you're having IC, and in essence, what they pretty much say is do a bladder coating, usually like Elmeron during. You would start it before you start, so you've got a nice extra layer of coating in there through the duration of the chemo. Um, that was straight from Dr. Parsons. And I know that I've asked several other doctors that over the years, and the answer is always the same, getting in a little bit of an extra protective coating. So if you can't do the Elmeron, then you could try the Bladder Rest or the Bladder Builder or the Sister Renew. Mallory says, you recently had a hydro and the glomerations were seen. Is this an official IC diagnosis? Well, it would have been 20 years ago. It's not today. It's not today because we now know those glomerations are sometimes caused by the test itself. So let me show you pictures. All right. So let's take a look at a couple of pictures here. So first of all, these are Hunter's lesions. Okay, so this is a profound area of inflammation with little arms going from it, right? So that's not glomerulations. These are glomerulations, these red spots. So those are the equivalent of injury. And back in 1988, 87, 88, when the National Institutes of Health released their first guidelines for IC, research studies, what they originally said was that if you found these, that made a diagnosis of IC official. That was in 1987. However, a couple of years after that, another research team stepped forward, and they did hydrodissensions on normal women who had no urinary symptoms at all, and the exact same thing happened. And so they now believe that not yet, 5 more minutes. 5 more minutes. So they now believe that these injuries slash trauma, that these are injuries slash trauma from the test itself. So a diagnosis of IC is a diagnosis of exclusion. We want to rule out other potential common causes, things that can contribute to it. So in addition to having a urine cytology to check for bladder cancer, as well as if you were a smoker, that's if you're a smoker, that's the big thing we look for there. Getting screened for any infections, anything like that, having a proper pelvic floor assessment, paying attention to your symptoms on when do you feel the best, when do you feel the worst, do you have pain center to your body, left to the body, right side to the body, etc., etc., etc. I hope that we have a video on our website, Linda, called the 5 subtypes of IC. I would really encourage you to watch that. Tanya says the estrase cream burns me more. Well, okay, you got to understand. Now, listen, if your skin is bone dry because of estrogen atrophy, anything you put on it is going to burn. Okay. And that's just because you don't have coating. But with estrogen, what happens is every subsequent time you use it, that burning gets better and better and better until a week to 2 weeks later, you should not have any residual discomfort. It should feel, it starts out as a burn for 5 or 10 minutes, but at the end of 2 weeks, hopefully it's like a little puff of warm air. So the only challenge here is the brand name. Premarin and estrase have a longer shelf life. And because they have a longer shelf life, they have more preservatives in them. And it's the preservatives that sometimes cause extra burning. So we tend to do better with a compounded preservative free estrogen cream. So, don't give up. You're not being physically burned. It's more a reflection of the quality and health of your skin. You don't have a protective coating there, and so that chemical is irritating. But again, the more you use it, the more your body is able to produce a little bit more mucus. Susan says estradiol with Egyptian magic compounded much less irritating. It's fine.
You have 5 minutes.
I know, it's okay. Don't.
I can't drive it.
I'm going to. Don't worry about it. Okay, guys, listen. That's what happens when you care for a 96-year-old and a 90-year-old. Is they get it in their mind, they have to do it now. Okay, so I'm going to go drive my 90-year-old mother somewhere. I'm gonna let this go for now, but when I come back, I will turn on the stream back on. We'll go for another hour before I've got to go pick her up again. Alrighty? Okay, guys, I'll see you in a bit. Life, right? It gets a little complex. I always try to be respectful, though. I really do. I do my best. All right, YouTube. All right, guys. I'll see you in a bit.